Hi, I'm Dr. Terence Lee from Fertility Care of Orange County. I'm here at the annual ASRM fertility meeting, and every year we come here and learn exciting things and ways to improve and have the technology get better success rate for our patients. We are now at a point where we're seeing great advances in embryology so that the embryo quality gets better and better. And really the one step that has not changed very much is the step of physically putting the embryo back into the uterus, the embryo transfer. So, as you know, in an IVF cycle, our patients are industriously taking their injections and staying as healthy as they can and having their hormones, subjected to swings. And then we get the eggs out and then hand it over to our embryologists who nurture and take very good care of the embryos, so now they're ready to be placed back in their home. So that's my job, is to do a perfect embryo transfer. Now, the key to doing a good embryo transfer is to have no surprises. So we do practice one ahead of time, because some women, their cervix curves upwards, some it curves downwards, and some it's like an S where it curves left and then it turns right. So we want to know about that ahead of time and map it out. In other patients, their cervix may be really, really tight, or they may have a false passage. So in those cases, we want to make sure to dilate the cervix ahead of time so that we don't end up doing dilation on the day of the transfer. We don't want to do that. There are 3 ways to do a transfer. Back in the old days, they used to be done blindly, basically just putting the catheter in without knowing where it is. Nobody does that anymore. Almost everybody does transvaginal or transabdominal ultrasound guided transfers. So that means that we can use the ultrasound to see exactly where the tip of the catheter is, so we can be 100% sure that that embryo will be going to the right place before we release it. So with the technology can keep advancing and we now get perfect embryos and we can do perfect transfers, then we should be seeing higher and higher success rates of people taking home babies with a single embryo transfer.